when we plan the implant, then we need to understand whether is there enough bone for us to place the implant in the desired location. Should we do any either soft tissue augmentation or hard tissue grafting needs to be done so that we achieve the aesthetics. So we reverse work our way from aesthetics to prosthetics to implant position. So that's how we do it. For any long-term success, we are looking at 2 to 4 mm of healthy bone that surrounds the implant, 3 mm of vertically attached soft tissue to keep the bone healthy, 2 to 3 mm of attached gingiva. And in specific to 3D implant position, the clinical roadmap will be, first as I said, we need to diagnose, plan and assess the risk. We assess the risk for aesthetics, we assess the risk for prosthetics, then we assess the risk for surgery. Then we plan the ideal 3D bone level implant placement. Once we have planned it, we decide, as I was speaking about, we decide whether any soft tissue procedures are required, hard tissue procedures are required, which will help us to plan our implant surgery as well as replacement. Also, today's patients are extremely aesthetic demanding, and most of the situation we end up with a maxillary anterior area where we need to extract teeth and put implants immediately, and we need to start plan for provisional. So provisional is not only for aesthetic and giving an immediate function. So when I say the quadrant of success, we are looking at optimizing implant aesthetics with neoprosthetic solution. There are 4 key components here. So those 4 components are the 3D implant position, the type of prosthesis, the aesthetic emergence, and how all these 3 things can be put together with the digital workflow. So that would be what will lead to the quadrant of success when we can actually optimize the aesthetics. So even though we will be going in the order of surgery, prosthesis and aesthetics, what we need to understand is we need to reverse work our way. So when I say reverse work our way, first we need to understand what is the aesthetic requirement for our patients. Once we understand the aesthetic requirement for our patients, we go back and then decide what will be the prosthetic solution for that specific aesthetic requirement. So once we understand the prosthetic requirement,
வீடியோ பிடிச்சிருக்கா லைக் பட்டன் கிளிக் பண்ணுங்க, சப்ஸ்கிரைப் பண்ணுங்க, பெல் ஐகான் கிளிக் பண்ணுங்க. இந்த மாதிரி வீடியோஸ் உங்களுக்கு வரும். Thank you.